So today we are going to see some the conditions which happen in the neurological system and in the human body as a whole, which is part of your syllabus. Okay, the first thing is atherosclerosis. Atherosclerosis is nothing but thickening of the inner surface of the blood vessel. Okay, anatomy you would have studied that the surface of the blood vessel wall is called the intima. Okay, here it becomes thickened. Why does it become thickened? Because of accumulation of fat material and deposits of calcium. Okay, so when these get deposited, there is infiltration by monocytes and macrophages. Okay, so even the smooth muscle proliferation occurs. All this leads to fibrosis, that is, it becomes thickened. It becomes like a fiber, and finally the fibrous substance becomes a plaque. Plaques is harder. Okay, so what ultimately happens is the blood vessel wall becomes hard and thickened. So it's like a pipe which you use for watering your plants. What will happen when there is a block inside? Okay, when there is deposition of layers, the amount of blood that is flowing through the artery will slow down and reduce. Okay, that is because the lumen is reduced. Lumen is nothing but the area through which the blood can go. Okay, mathematically it can be called as the diameter, the amount of space that is present in the blood vessel reduces because the vessel wall becomes thicker and harder. So it becomes like a block, not a complete block but a partial block. So it reduces the blood flow from occurring. The next thing that can happen when atherosclerosis forms is the plaque which has formed can become ulcerated. Okay, and it can break free. What happens when it breaks free? It will start going in the blood. When it is going in the blood, it can become an embolism. We are going to study what embolism is. Embolism is nothing but any material which is flowing in the blood which can suddenly stop the blood from flowing as it reaches a smaller vessel. See, in a larger vessel, the embolism will be like, it will not block the blood supply, but as it keeps moving in the bloodstream, it will sometimes pass through a smaller vessel and it can block the blood from flowing. So that is the risk of embolism. So the embolism can lead to infarction. Infarction is complete stoppage of blood supply, which leads to death of tissues. So we have to prevent atherosclerosis from occurring. If not, it can reduce the blood supply to certain important areas in the body, especially if it happens in the brain or any other place. Then it can lead to potential serious complications, and it can also give a high risk of embolism from occurring, which can lead to sudden myocardial infarction or stroke from occurring. Okay, so when the atherosclerosis forms and the emboli goes and blocks a vessel in the brain, it leads to stroke, okay, or cerebrovascular accident. Here the person suddenly has a block in the brain artery, and that leads to death of some brain tissue because the blood cannot pass across that block. And when death of the brain tissue occurs, it means the person has had a stroke. Sometimes it is fatal, sometimes it is serious and can lead to lifelong complications. So there are two reasons for stroke from occurring. One is the hemorrhage. Hemorrhage means bleeding. The other reason is the infarction, where there is a stop in the blood supply. Okay, so what are the risk factors for atherosclerosis? When does atherosclerosis occur? Hypertension, hypercholesteremia, diabetes, smoking. These are some of the common risk factors. Increased blood pressure, high cholesterol, diabetes, and smoking are the risk factors. Other risk factors are family history. If there is a history of atherosclerosis in the family, the age of the person. An older person has changes in the blood vessel. We already studied in geriatrics that as a person gets old, there is changes in the blood vessel, increased stress, then hormonal factors. These are all risk factors for atherosclerosis. So where does the atherosclerosis occur? It occurs mainly in the large arteries. Okay, and if it occurs in the artery, it's called, because it occurs in the artery, it's called arteriosclerosis. And atherosclerosis is commonly seen in areas where the artery divides into two, or the bifurcation points. Okay, where it divides, one main artery divides into two. So the bifurcations where it is common are the common carotid artery, where it divides into the external and internal carotid artery. So that place it is common. Atherosclerosis is common. So when atherosclerosis occurs, it can cause serious problems later on. So we have to prevent it and treat it. How do we prevent it? Lifestyle changes, reduce the control diabetes, control hypertension, okay, control the cholesterol levels. So these are the lifestyle changes that are very important. Other than that, medications can be given. So medications are mainly given to reduce the cholesterol levels. Cholesterol lowering drugs like statins and fibrates are given. Then angiotensin converting enzyme inhibitors. So these prevent the narrowing of arteries. Beta blockers, calcium channel blockers will help in reducing the blood pressure. So we are reducing blood pressure, trying to prevent narrowing of arteries, reducing cholesterol, and then we can also give diuretics or other drugs to reduce the blood pressure. Then anticoagulants and antiplatelet drugs to prevent the blood from clotting. Okay, see, blood clots, if they form, then they can be high risk of forming embolism, and so they are prevented, or the chances are reduced by giving anticoagulants and antiplatelet drugs. So aspirin is something which is commonly given, and it is seen to be effective. So surgical intervention can also be done other than medications. So angioplasty is done. So angioplasty is a common method of intervention done to reduce the atherosclerosis. The next topic is thrombosis. Okay, thrombosis is nothing but the pathological formation of blood clot in the cardiovascular system. So it's not a normal blood clot, it's a pathological formation of blood clot. Blood clots, when you start bleeding, there is clot of the blood, but here it's a pathological formation of blood clot, and the main causes are antithrombotic inhibition of platelet aggregation. When there is abnormality of blood flow, abnormality of the vessel wall, or abnormality in the coagulation of blood, all this can lead to thrombus. As I said, thrombus is nothing but formation of blood clots. Okay, so when the vessel wall, arterial wall is abnormal, it can lead to blood clots. When there is abnormal blood flow, okay, that can lead to blood clots. And coagulation, when it is not normal, it can lead to blood clots. Thrombosis can occur both in the veins and in the arteries. Okay, when there is inflammation in the vein, it's called as thrombophlebitis. Inflammation in the vein is called thrombophlebitis. So thrombus in the vein is caused by primary platelet thrombus. That is, the platelets, they aggregate on the intima. Intima, as we said, is the vessel wall. Okay, so the platelets aggregate there, and that can be a cause of thrombosis. And the next reason is the deposit of fibrin. Okay, that can lead to thrombus formation. Then there is occlusion. Occlusion is nothing but block, and that can lead to thrombus formation. And when there is a consecutive clot or propagated clot, all this can lead to thrombosis. In the vein, the thrombosis can be mainly caused because of immobility. When a person is traveling or is immobile for a long period of time, it leads to thrombosis or hypercoagulability. That is, there is high risk of increased blood coagulation. The blood clotting is more than normal, then that can lead to thrombus. Then when there is a trauma to the vein, so that can lead to, when there is any injury to the vein, that can lead to thrombosis. So how does immobility cause thrombosis? Immobility is nothing but prolonged bed rest or prolonged rest. Even a person who is traveling in an aeroplane for many hours without walking, they are at high risk of thrombosis. People who are in the hospital, admitted in the hospital, like bedridden patients, old patients, people who have had stroke and they are lying on the bed, these people are at risk of thrombosis in the vein. Pregnancy, obesity, and any medication which causes hypercoagulability like estrogen. Then smoking, if the person is genetically predisposed to thrombosis, polycythemia, cancer. So all these are risk factors. Then trauma to the vein can lead to thrombosis. Like when there is a fracture, it can cause thrombosis. That is because of the trauma to the vein. And any invasive procedure, when it is done, if it causes trauma to the vein, that can also cause thrombosis. So deep vein thrombosis is the name which is given to one of the types of thrombosis in the vein. The other types of thrombosis are portal vein thrombosis, renal vein thrombosis, jugular vein thrombosis. So deep vein thrombosis occurs in the lower limb. Okay, and all the others, based on the vein where they occur, they are called deep vein thrombosis or portal vein thrombosis, renal vein thrombosis, or jugular vein thrombosis. So as we already saw, the risk factors for thrombosis are hypertension, diabetes, cholesterol, family history, males are at higher risk than females, obesity, smoking. Okay, all these people are at high risk of thrombus formation. Okay, thrombus in the arteries, it causes stroke, myocardial infarction. Okay, so what is myocardial infarction? It is commonly called as heart attack, and stroke is nothing but cerebrovascular accident. So when there is artery wall which has thrombus formation, it reduces the blood supply and it can lead to cerebrovascular accident, myocardial infarction, when a emboli comes in, gets stuck and prevents the blood from flowing across the site of the thrombus. Okay, so what happens to the thrombus? It either becomes an emboli, that is, it breaks away. The thrombus, which is the blood which is clotted on the vessel wall, it can break away and become a emboli, or it could become fibronalized. It could be fibronalized. There could be retraction, or it could become organized. Okay, calcification can also occur. Next we come to embolism. Embolism is nothing but a mass of material which is present within the vascular wall and it moves in the bloodstream and blocks some vessel. Okay, and most of the emboli are formed from thrombus. Thrombus, as we said, it is clotting of the blood on the vessel wall. So this clot can break away due to various reasons, and when they break away, they keep circulating in the bloodstream, and any particular area where the lumen or the vessel has narrowing, or where there is a thrombus formation and the lumen has decreased, this emboli can go and get stuck. It is nothing but a piece of blood clot that is traveling in the blood. It completely prevents blood from flowing across the block. That causes myocardial infarction or stroke. Okay, There are different types of embolism. When it occurs in the pulmonary system, it's called pulmonary embolism, arterial systemic embolism, thromboembolism, fat embolism, gaseous embolism. See, fat deposits also can break away. It's not just the thrombus that breaks away. Fat deposits can break away, the atherosclerosis. That can lead to fat embolism. Sometimes there are gas particles in the bloodstream which form gaseous embolism. So the treatment for thromboembolism is mainly anticoagulation. That is, we thin the blood. Okay, when the thrombus and the embolism is formed because of clotting or thickening of the blood or coagulation of the blood. So we are trying to anticoagulate it or reduce the thickness of the blood or thin the blood using heparin, low molecular weight heparin, that is enoxaparin, warfarin are commonly given for people who suffer from thromboembolism. Okay. Next we come to hypoxia. What is hypoxia? Hypoxia is nothing but brain not getting enough oxygen. When does a person not get enough oxygen? When they are drowning, choking, suffocating, or having a heart attack. The brain does not get enough oxygen. So when the brain does not get enough oxygen, it leads to brain injury and even death of some tissues in the brain. So other causes are stroke, head injury, carbon monoxide poisoning. All this can cause brain hypoxia. So when you studied in the first year in the blood supply to the brain, as well as transportation of arterial blood gas transportation, you would have studied that the brain needs a lot of oxygen, and there should be continuous supply of blood to the brain. If there is even a block of oxygen to the brain for a few minutes, then it can lead to serious complications and even brain death. So when these conditions occur, that is brain injury or head injury, stroke, carbon monoxide poisoning, or choking, somebody is drowning and they cannot breathe, so all these can cause brain hypoxia. There are medical conditions that cause brain hypoxia, like hypotension, decreased blood pressure, extremely low blood pressure. Okay, then during surgery, when anesthesia is given, because of the anesthesia as a complication, it can cause hypoxia. Choking, somebody is eating the food and they start choking, then it can cause hypoxia. Carbon monoxide poisoning can cause hypoxia because there is no oxygen supply. Drowning, the person cannot breathe because he is underwater, that can cause reduced oxygen supply. Or people who have got in a fire accident and are breathing smoke, they can have hypoxia. People who are traveling to high altitudes, mountaineers, people who are in open helicopters or flights at high altitude, what will happen is there is less oxygen in the atmosphere, that can lead to hypoxia. Then head injury, strangulation, somebody is being strangulated, okay, or asthma attacks, difficulty in breathing because of various reasons. All these kind of people will suffer from brain hypoxia. So what are the symptoms? What happens? How can we diagnose brain hypoxia? Okay, there is temporary memory loss if they do not have enough oxygen supply to the brain. They are not able to move their body. Attention is reduced and they cannot make decisions. They are like in a delirium. Okay, some severe symptoms: when there is no oxygen supply to the brain for a longer period of time, or there is complete blood loss, complete oxygen supply loss, it can lead to seizures, coma, and brain death. Okay, how can we diagnose hypoxia? We can check the blood to see the amount of oxygen in the blood. Then MRI scan, CT scan, echocardiogram, electrocardiogram, electroencephalogram. Okay, EEG or electroencephalogram will measure the activity of the brain, just like the electrocardiogram or ECG measures the heart activity. So all these can help in diagnosing hypoxia. So how can hypoxia be treated? Immediate oxygen restoration needs to be given. Okay, the cause of hypoxia has to be removed. If a person is in high altitude, he has to be brought down to lower altitude. Anybody who has any choking, strangulation or drowning, they have to be removed from that place. Or if person is caught in a fire and not able to breathe, they have to be removed from that area and oxygen supply has to be given. Usually ventilator support is given immediately, and IV fluids are rushed, and the cause of hypoxia is removed. Blood pressure has to be reduced. Okay, most of these people start suffering from increased blood pressure, and any anesthetics or seizure curbing medicines can also be given for people who suffer from hypoxia. Okay, the last thing is aneurysm. Okay, aneurysm is nothing but dilation of the artery or heart ventricle caused by internal elastic lamina damage. The vessel wall, you have blood vessels. When the vessel wall is damaged, it leads to aneurysm. Aneurysm is nothing but a malformation. Okay, it is usually called a arteriovenous malformation. Either the artery or the vein wall, there is a malformation. It is not normal, it is abnormal vessel wall. Okay, so the causes are atherosclerosis, or it could be traumatic, or when there is spontaneous dissection of the vessel wall. Infection of the vessel wall also can cause this problem, and high blood flow can also lead to aneurysm. Okay, aneurysms are rare in congenital, that is, people when children are born, the aneurysm is not common. So these are the reasons for aneurysm formation. Congenital aneurysms are very rare, but they can occur. Okay, there are people who have congenital aneurysms where right from birth they have arteriovenous malformation, and it can lead to sudden burst, and hemorrhage can occur from the aneurysm. Okay, I hope you understand what aneurysm is. When the vessel wall there is a damage, it can burst suddenly, leading to blood loss or hemorrhage. The shape of the aneurysm can be saccular, like a sac, or bulb shaped. Okay, so it protrudes on one side of the blood vessel. The area where it is weak, it starts protruding when the blood goes quick through the blood vessel. Or the aneurysm can also be fusiform or spiral shaped. Okay, and cerebral aneurysms occur around the circle of Willis. Okay, if you study the blood supply to the brain, there is a circle of Willis and the middle cerebral artery. So in that area, aneurysms are common. Okay, and if the aneurysm is present between the arachnoid and the pia mater, then it can lead to subarachnoid hemorrhage when the aneurysm bursts. Okay, there are a lot of people who will have an aneurysm which is normal. I mean, normal in the sense they do not have any complications or signs and symptoms till it breaks. Okay, so the aneurysms have to be identified, and because it is a high risk, it can suddenly burst and cause death, because there will be hemorrhage or bleeding from the aneurysm, and if they are not immediately treated, then the blood loss within the system can lead to shock, and it will lead to death. So in very few cases, multiple aneurysms are present. Okay, so if a person whose family members have suffered from subarachnoid hemorrhage, or they suffer from polycystic kidney disease or collagen disease, then the risk of having aneurysm is higher. So remember, aneurysm is a malformation or a abnormal formation or sac-like structure in the artery or vein wall. So what happens to this is, it can be a sac shaped one, or it can be a fusiform one. So this can suddenly burst, especially in places where it is thin. The artery and vein where it is thin, it can burst or it can leak. and the blood which is supposed to go inside the artery will come out through this break and flood the other areas. If it is in the brain, it can lead to intracranial pressure and other complications. It can lead to seizures, various complications, and the person may die. Any other place also, the hemorrhage will mean that their person can go to shock. So any arteriovenous malformation has to be treated if it is diagnosed. A lot of people will have these aneurysms and they will not even know it because there will be no symptoms, and suddenly one day they will collapse because of a rupture of the aneurysm, and most of them end up dying if not immediately treated. Okay, hope you understood these important aspects of neurovascular problems, that is atherosclerosis, thrombosis, embolism, aneurysm and hypoxia. Thank you.